guys, welcome to my YouTube channel. I'm so excited to have you on this YouTube channel. My name is Ms. Nisang, and today we are going to be having a very nice time learning this mental disorder. So without further ado, let's jump right into the video. Alright besties, today we are going to be talking about eating disorder. Eating disorder, there are a lot of eating disorders, and today we are going to look at three major types of eating disorder. Eating disorder are those conditions that poses both mental and physical danger, places our health at a very low state, and our mental health especially is really concerned here. So eating disorder, like I said, there are various types of eating disorder. Today we are going to be talking about the three common eating disorder, and the first one on my list is binge eating. This is a mental eating disorder that refers to a situation where an individual eats an overly large amount of food which is not really necessary, which is abnormal. The person eats this food too much, and the person eats this amount of food in a specific time, like too large an amount at a specific time. The person also eats until he's filled, but they can't stop eating. Even when the person is uncomfortable, he still keeps on eating. That is binge eating. It's a mental disorder. When you've eaten to the point that you're full, but you can't stop, you keep on eating. Even when you're uncomfortable, you are still eating. And at this point, the signs that you can see for this patient is the patient feels guilty, ashamed, or distressed after consuming an overly large amount of food, which normally is not supposed to be. The person usually feels embarrassed eating in public because he or she is going to consume a very large amount of food that it's not normal, like it's not a normal amount to be consumed. So that's that for binge eating. What are the signs that you use to identify someone that has binge eating disorder? Eating an overly large amount of food, eating even when you feel like you're full but you can't stop yourself from eating again, you keep on eating, and even when you eat till you get uncomfortable, and you don't like eating in public because you don't want every other person to see the amount of food you're going to consume. Disorder number 2 is anorexianervosa. This is a mental eating disorder that refers to a situation where an individual is eating a very small amount of food, and this particular food is limited to a particular class of food at a time. Eating an amount of food that is too much, and the person is always conscious of being overweight, whereas the person is underweight. So the person feels is overweight, is above the normal weight for an healthy adult or an healthy individual, and the person is still feeling that it is underweight. What are the signs to know if someone has anorexianervosa? This is when sign number 1, the person is not interested in eating. When the person wants to eat, he eats a very small amount a very small amount of food in a specified class. A particular class of food. The person now decides to take very little amount and may not even eat after hours because the person does not want to be overweight. The person already feels that he's overweight, whereas he's underweight. Sign number 2, the person has dry yellowish skin because the body lacks nutrients and vitamins because of eating little amount of food that is not even rich to do anything for the body. Mild anemia, because sufficient nutrients are not taken. There is muscle wasting, and the person is prone to bone diseases like osteoporosis, thinning of the bone, because there are no nutrients to support and provide enough vitamins for the bone. Feeling cold all the time because there is a drop in the temperature for the internal organs. Slow pulse and breathing rates. This person has a slow pulse rate, also a low blood pressure because of eating very little amount of food and starving his or herself for a period of time in order not to get overweight. Last sign, the person feels there's this image distortion. The person feels that he is overweight even when the individual is like this. he feels is overweight. Now the third mental eating disorder we are going to be looking at today in this video is bulimia nervosa. Bulimia nervosa. In this situation, the person has periods of binge eating. That is, the person eats large amount of food for a while and then has a way of purging out the food that the person eats, because it's equally thinking maybe eating too much is going to make me overweight or something. So this person now eats, after eating a very large amount of food for a particular time, the person induces vomiting. The person wants to throw up so that they can reduce the content of the food that they are taking and get ready to eat again. So now this is a situation where after eating, you induce yourself anyway to make sure you threw up of the food you've eaten a few minutes ago and take new ones. Sign and symptom: after eating, the person gets to the backyard or anyway and take purge, laxative, anything. It can even insert the finger into the mouth to induce vomiting and empty whatever food the person has eaten. Chronic inflamed sore throat. You know, this person is regularly throwing up. So the airway, like the throat, you know, is inflamed because there is always vomiting, you know. And now there is tooth decay for this patient because the teeth constantly have exposure of the teeth to stomach acid. You know, when the person vomits, the content of the hydrochloric content of the stomach pours itself on the teeth and it predisposes the teeth to decay. Excessive and intensive exercise. Since this person feels he's eating too much and is trying to get rid of the food he has eaten, he or she involves his or herself in intense exercise, even when the person does not need it. You know, exercising for a very long period of time without taking breaks, because you're very conscious, you don't want to be overweight. You're always exercising, even when there's no fat there to burn. You're always exercising. When you begin to exercise, you can't stop. You know, this is a mental disorder that actually affects your nervous system. So when you get into intensive and excessive exercise, you find out that you can't stop it because you're trying to counteract the effect of the binge eating that you practiced a few minutes ago. Besties, if you're not subscribed to my channel, please subscribe to my channel, like, comment, share, and drop your questions in the comment section. If you have any question to ask me, please drop it in the comment section and I'll attend to the question. So that is all I have for you for this video, mental eating disorder. If you notice this sign in yourself, your loved one, your family members, your colleague, your friend, anybody, it is time to eat to the hospital. The person may not accept that is having an eating disorder, but it is your duty, as a result of watching this video, you're now aware. For you to like talk to the person, it's time to go to the hospital and seek medical attention. Go to an hospital where they have enough and qualified hands to take care of this mental problem. You know, it's a common problem that is usually ignored because we don't attach so much importance. But I tell you that anorexianervosa is one of the leading cause of mental death in the US. That's what the study has to show. So it is an anorexianervosa. It's very, very, very dangerous because it has a very high rate of death. So let's take it serious. Let's take care of our mental health. Let's protect our mental health because we are our mental health. And whenever our state of health is very low, of course we can't deliver, we can't do anything. So take care of yourself until I come, same channel. Have a nice day. Bye.